Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today, we welcome back on the show Scott Abramson. He's a neurologist, and his KevinMD article is titled Why This Doctor Prefers Perfectionist Physicians. Scott, welcome to the show.
Thank you, Kevin. And thank you for having this platform that gives people to expound on alternative ideas to the mainstream.
All right. Well, thank you so much for sharing your insight and perspective. Now, before we get into your article, for those who didn't listen to our first episode together, that was about a year and a half ago, just briefly share your story.
Yeah, so Kevin, I was a neurologist at Kaiser Permanente in Northern California. I worked there for 40 years. And during that time, I was very passionately involved with our communication mission to teach doctors communication skills, and also with our physician health and well-being mission.
All right. So tell me some of the challenges that you faced when it comes specifically with those communication skills, and what did you find when it came to your work in the well-being committee?
Well, as far as the communication issues, I think the thing that was so prominent is that I think George Bernard Shaw said this. He said, the problem with communication is the illusion that it has taken place. And that is just so common with so many doctors. If you were to just monitor an encounter with a doctor and a patient, you'd ask the doctor, how'd it go? He'd say, man, it was great. I gave some great education. I did great. You talk to the patient and say, I didn't understand a word he said. So that's what we kind of worked on, is that distance, bringing that distance closer together.
Yeah, I think that what you just described is very common in terms of that almost diametrical perspective that one gets after that encounter. So how would you go about fixing that?
Well, there's a plan that we had, a program that we had. We could label it the 4 habits. It's not a whole lot different from a lot of other plans out there, but basically one of the things is getting patient perspective, is trying to find out what's here. I can boil it down to this, Kevin. It comes down, most doctors, our paradigm is this: what's the matter? What's the matter? Let's find it, let's fix it, let's explain it, let's treat it. What's the matter? But we try to change that dynamic to what matters. What matters to the patient? What do you think this is? What are you afraid this is? How's it impacting your life? That was, I think, if I could sum it up in just a brief sentence or two, that's it. Yes. The paradigm from what's the matter to what matters.
Oh, that's so well said. That's actually the first time I've heard that. So I think that is a very resonant word. So let's talk next about your KevinMD article, Why This Doctor Prefers Perfectionist Physicians. Now, how did this article come together?
Well, Kevin, it came together because I read a lot of your articles. A lot of the articles were about the perils of perfectionism and how perfectionism causes burnout and all this stuff. And I don't know about you, but sometimes when I listen to the TV news, I sort of talk back to the news and I say, "Oh, that's not right," And so when I read these articles, I had that reaction. I felt like I had to talk back to it. And some of the points that people made, well, and maybe remember some more of these points, but as I recall, they would say, well, perfectionism is bad because we do it out of fear. We're afraid we're going to do something wrong. And my reaction to that was, so what? I mean, I do a lot of things out of fear, and it's good. I mean, I'm afraid that I'm going to hurt a patient, so I study more. I mean, a lot of doctors are like this. So my original reaction was, what's wrong with doing things out of fear? I think it makes us better doctors. I mean, in the article I wrote, I made an analogy between an airline mechanic. I mean, would you rather be on a plane with an airline mechanic who is perfectionistic and won't go home till he's checked everything out and made sure everything's, or would you rather go to ride a plane that had an airplane mechanic that clocked out at 5 o'clock, had dinner with his family, went to, Pilates class and was a happy guy? I'd rather have the perfectionistic guy who tortures himself to make sure that everything is okay. And torture is not a good word, but so, and the other thing was not only, so part of the people wrote that it was done out of fear. The other thing was that it isolates people. I read people would say, well, if you're perfectionistic, you look down on the other people who are not so perfectionist, who leave at 5 o'clock and go to goat yoga and all that stuff. So you isolate yourself. People don't like you. And when I read that, I thought, well, so what if they don't like you? I mean, it's about the patient and the patient's well-being. And as a matter of fact, maybe they won't like you because they think you look down on it, but I bet you they'll respect you. And I bet you they will say, hey, if I need a doctor for me or my family, That guy may be a miserable guy, but he's a great doctor. He will check everything. And then the third thing that I remember reading about from these articles is, well, perfectionism, it causes anxiety, and the anxiety causes depression, and depression causes burnout. And, we need to set boundaries. That was the word, set boundaries. We need to, okay, I'm only going to answer so many phone calls. I'm going to leave here at 5 o'clock. I'm going to have dinner with my family. I'm going to drive home. I'm going to do some mindfulness, do some journalism. I'll be a happier doctor. And when I read that, that rationale, I thought to myself, now, wait a minute. And by the way, Kevin, we're talking about perfectionism. Now, I'm not talking about pathological stuff where, you check an email 15 times to make sure the grammar's okay, or you flush the toilet 10 times. And I'm talking about the authentic, normal perfectionism that we all have. And so when people would talk, well, it causes anxiety, it causes depression, it causes burnout. But this is something that's ingrained in our DNA. And I would ask those people that have set boundaries, right? That leave at 5 o'clock, that say, okay, I've answered as much as I can. It's as good as it gets. I'm going home to my family. Are they really going to be happier? Because are they going to be waking up at 2 a.m. thinking, oh my God, there were these 5 x-ray things I didn't check. Maybe one of them has pneumonia. Maybe there were these 3 phone calls that patient called me, and they're waiting by the phone right now for me to call them. And they're, waiting to hear good or bad information. They're not going to sleep tonight. Am I going to sleep better? Am I going to sleep better now because I set my boundaries, because I left at 5 o'clock, because I had dinner with my family? Or am I going to be miserable because I'm waking up at 2 a.m. thinking I could have helped these people? So it's a complicated thing. It's not this, it's much more complicated, I think, this perfectionism issue.
Now, does it have to be a binary choice? Does it have to be either perfectionism or boundaries? Yeah. Is it possible to have both? Is it possible to have a physician who sets boundaries, who goes home to eat with their family, yet still maintains standards close to perfectionism? Is it possible to have both?
I think it is. I think that's what we need to strive for. You see, that is what we see. That was the thing in these articles that sort of upset me, that we're trying to obliterate this perfectionism from our DNA. And it won't work, because our perfectionism got us to where we are. I mean, all our life, we said to our, we do it right. We work hard, we produce. I mean, if we brought home a B in middle school, it was a family crisis. We aced our SAT, our PSAT, our MedCap. So it's in our DNA. And I think the solution comes, Kevin, it's not to ignore or obliterate perfectionism, but it's to honor it, to realize it's there and work with it from there, and to the best of our ability to help ourselves and our patients. Because I don't think we're going to be happy people or happy doctors or less anxious doctors if we try to just obliterate it from our mind and do this. I think there is honestly, and what will work for one person may not work for the next person. I think it's an individual thing how we have to do this. But the answer is not in obliterating, we have to accept it and honor it and work with it.
So one of the things that you said as part of your story is that, would you rather see a perfectionist doctor or a doctor who strived towards perfectionism yet was miserable, right? So that's the thing I'm trying to square, right? So, we talk a lot about physician burnout. You know all the statistics. 60% of doctors are reported to have burned out, and some people say it's because of the expectations that are placed about them. So, what about the effect of that standard of perfectionism on the profession as a whole? Like, how do you square that?
Well, and that's exactly. I think you present this exactly right, Kevin. Is like. And people use the term burnout, and what is burnout? And people say it's moral injury. And what's moral injury? People don't say, what is moral injury? And let me give you an operational definition of moral injury. Moral injury is when our actions don't meet our values. When our actions don't meet our values. And I can tell you this, When I worked at Kaiser these 40 years as a neurologist, I faced that every day. It happened to me all the time, bit by bit, little chinks. And for instance, so on my homepage, which is this thing that patients read when they come to visit you, and a lot of doctors, I would have on my homepage this sentence. It said, "I treat all my patients as if they were family," right? As doctors say that. So here's what would happen. A typical thing. I got a call from a patient Friday afternoon, Parkinson patient, and things were not going right. They needed to be seen. But it was Friday afternoon. I couldn't see. There was just no way I could see them that day. So I said to my nurse, tell them to just increase the sentiment, do this, do that. But here's the thing. If I really lived up to my values of treating everybody like family, I would have seen that person. But I didn't. I couldn't. And in that case, actions did not live up to my values. And that's a little bit of moral injury that's happening all the time to all of us. So, again, what's the solution to that? It's going to be different for everybody, but it's a tough situation. It's tough on all of us, and it's going to be tough. It's tough on every one of us. And that's the battle we have to face, is when our actions don't meet our values.
So for those physicians who are struggling between those two poles that you are just articulating here, what is the path forward for them? I'm sure a lot of physicians, they do want to strive towards that ideal of perfectionism and be there for their patients all the time. But what is the solution? Because it's very difficult to have it all, right?
Yeah. Well, I think for some people, it may be kind of adjusting their practice. It may be cutting back to 3 days a week and taking 2 days off, and using those days for family to catch up with paperwork and all the stuff that we do. It may be job sharing. It may be, that sort of thing may work. And of course that will entail, cutting back on your expenses, maybe not buy the biggest house on the block or whatever. I mean, that may be one kind of practical thing, and there may be a lot of practical things that you could do like that to rearrange your practice. I think that some of the answers have to be internal, that you have to think in different terms about your patients. A colleague of mine is one of these guys. He's he jogs like 7 miles every day, eats broccoli, sprouts, and all this stuff, really healthy. So he's jogging one day, blows out his knee. And and he knew, being a doctor, that in the realm of things, a lot more serious things could happen to him. But he was devastated because he was invincible. He was invulnerable. He ate broccoli. So he goes through surgery. Everything comes out right, and he can't wait till the first day of rehab. He can't wait because he's going to work harder and stronger. He's going to come back better than ever. So he goes to the physical therapist. He's waiting in the waiting room. Physical therapist comes out, looks at the chart, looks at the guy in the waiting room. He says, physical therapist says, you're my 7:30 patient. The guy looks at him and says, no, I am not your 7:30 patient. I am the guy to whom you're going to give his life back. And if we have our mindset and we think in those terms, that every patient that we see, in some way, we are going to give them a little bit of their life back. Maybe it's just reassuring them that the cough is not cancer, or that, the rash that's keeping them up all night is, we can get them to sleep, But a lot of times we think of those things as, kind of just another patient. I'm behind. Let me get this. Let me, get these people off the assembly line here, But if we think in terms of each patient that we see, we can give a little bit of their life back, I guarantee you our lives, as professional lives as physicians, will be imbued with a lot more joy and a lot more meaning.
We're talking to Scott Abramson. He's a neurologist, and his KevinMD article is titled, "Why This Doctor Prefers Perfectionist Physicians." Scott, tell us some of your take-home messages that you want to leave with the KevinMD audience.
It just as you say, Kevin, it's complicated. This work balance, this burnout, this moral injury, it's a complicated thing. I don't know that I have an answer. It's going to be different for everybody, but I can tell you the answer is not to try to obliterate perfectionism from our DNA. We have to honor it. We have to work with it and work with it as best we can to help ourselves and our patients.
Scott, thank you so much for sharing your perspective, time, and insight. And thanks again for being on the show.
Thank you, Kevin. I so appreciate it.